On today's episode, I interviewed Dr. Sairam Atluri, a interventional pain physician who is the founder of StemCures.com. Dr. Atluri specializes in treatment of the spine, including with treatments such as bone marrow aspirate concentrate derived stem cell treatments. Hello and welcome to the Regenerative Medicine Report. I am Siddharth Tambar, your host and practitioner in regenerative medicine. Today's guest is Dr. Sairam Atluri, interventional pain physician and anesthesiologist who has a deep interest in regenerative medicine. He is an instructor and contributor to the regenerative medicine guidelines put forth by the American Society of Interventional Pain Physicians. He's co-editor of the Essentials of Regenerative Medicine in Interventional Pain Management, founder of StemCures.com, located in Cincinnati, Ohio. Dr. Sairam Atluri, welcome. Thank you for joining me.
Glad to be with you, Sid.
Excellent. So let's just get started with it. So Sairam, you're a very well-experienced interventional pain physician in practice for about 20 years. Tell me how you originally got involved in regenerative medicine. What was the evolution that eventually led you into that?
So, as you know, most of these interventions, they help many patients, but not all. I always was looking for better treatment alternatives for patients. And then I was talking to Dr. Manchakanti, who's the president CEO of ASIP, one of the largest pain organizations. And he said, he told me you need to look into regenerative medicine and stem cells because it seems to be having a good future. This was about 4 years ago. And then I got looking into it and almost got consumed by it and dove into it with passion and started doing it and seeing amazing results. It only added fuel to the fire. So that's how this whole thing started.
I think that term consume with it is how a lot of physicians who really have a professional and deep interest in regenerative medicine progress into this. It starts at a relatively low level and you just realize there's so many more layers and depth to it. And so I really like how you say that because I think for a lot of my colleagues and our colleagues who I think we respect and have a real deep interest in it, it's certainly professional, but it's at a little bit higher level because you realize you can do more for patients. And consumed is an interesting but I think accurate word as a professional in terms of how this kind of gets into your blood and your bones.
It truly is. I've actually gone back to the nerd I was in medical school, and you have to read so much and put a lot of effort reading all these new articles. And this field is moving at the speed of light. It's hard to keep up, but when you have a lot of interest, it just makes it so much more fun, and I'm really enjoying. And what gives me the biggest joy is the patient responses. Being in chronic pain, not myself, but treating patients with chronic pain for the last 25 years, by the time I end up seeing the patients, I am the last resort or end of the road. And these are the patients who've tried multiple procedures, have been suffering for many years, seen many physicians, and some of them including major surgeries and still in pain. And when you do these stem cell procedures and how quickly and how well they respond, it's actually mind-boggling. Even I'm surprised with the results.
Excellent. You're right. I think what's surprising is that if you take a more comprehensive approach to treating these conditions with the orthobiologic treatments that are evolved, hitting really all the relevant pain generators, it's surprising how many people can really benefit, even though they may have pathology that looks relatively extensive, even if they failed multiple other treatments. It can be a surprise from a professional standpoint as well. Tell me, how is it that you have evolved and how you're currently using some of the orthobiologic treatments in your practice? What are some of the more interesting conditions that you're treating or more common ones? And techniques that you're using that you think have a lot of value?
So I think I'm a little different from most of our colleagues. One of the few who has stuck predominantly to bone marrow stem cells. I rarely or have never done maybe one or two cases of PRP. It's just that I want to tackle back pain, which is one of the commonest pain condition and also the most difficult conditions to treat in medicine. And to get the best results, what I've found was that by injecting, like you were talking earlier, injecting multiple pain generators, the discs, the facets, and sometimes the SI joints, we're seeing really good results and long-term results. High percentage of patients getting high percentage of relief long-term. So it started off, I'm a spine guy, interventional spine guy. Started off doing the spine, and after seeing how well the patients are responding, then I moved on to the large joints, like the knee, hip, and shoulder. And a lot of these patients, Siddharth, we are avoiding fusions and also joint replacements. Patients come to me if they want to stay away from knee or hip replacements. And we're doing bone marrow stem cells, mostly intra-articular and also some ligaments. Unfortunately, a lot of these patients also have subchondral changes of the MRI. Those patients, we're doing subchondral injections. And like I said today, earlier, the results have been amazing.
I think treating the subchondral bone is really key. I think that's something that we're starting to see slowly, progressively more evidence that it helps. And I know amongst a lot of our colleagues, there's a growing understanding that if you see that signal, it's a dynamic process that can still be treated. And I know anecdotally, when I've had the same patients that I've treated earlier on, just treating joint and ligaments with BMAC, bone marrow aspirate concentrate, and then later on treating the bone as well when they have that appropriate bone marrow signal, the difference has been significant. And I think it's one of those areas that sadly is not always reported on in MRIs, and it's one of those areas as a musculoskeletal expert you have to be cognizant of, and you have to include that in your litany of things of pain generators that you want to treat. Tell me more about some of what you're doing in the spine in terms of treating intradiscal and things of that nature.
Yeah, I think disc is, in my opinion, I know there is a controversy about it, but in my opinion, disc is one of the main pain generators. So I've been focusing on that a lot. All over the spine, cervical, thoracic, and lumbar. Majority of the cases that I've done are obviously lumbar because that's the most commonest area of pain. And any changes on the MRI that I see on the disc, most of the patients usually come with pain by the waistline, either unilateral or bilateral. So I tend to inject both the L4-5 and L5-S1 disc. Because I don't know where the pain is coming from. I also inject the facet joints almost all the time. Nobody really knows, Siddharth, where the pain is coming from. Is it the L5-S1 facet? Is it the L4-5 facet on the right? Or is it the L5-S1 disc? So I tell my patients what we're doing is a shotgun approach, injecting multiple areas which are capable of causing pain. Knowing that there's a good chance I'll be injecting a normal, non-painful or non-inflamed pain generator. But the good thing is stem cells, they're very smart. If they're not needed, they don't get activated. If they don't see inflammation, they don't get activated. And they're not harming the patient by injecting it in a normal area. So that's the approach we've taken, and it is serving us well now, and the patients.
I think it's correct to definitely take that comprehensive approach, but I wouldn't call it shotgun, right? I mean, you're coming at it in a very targeted fashion. I think a regenerative medicine expert has to have that combination of an interventional orthopedics perspective, meaning very highly guided X-ray, ultrasound guidance skills to really hit that very specific target. They need to use the right orthobiologics. And the interesting thing about BMAC is that there is data that goes back to really the mid-90s in terms of the effectiveness of BMAC. So while people use more platelets generally for back than BMAC, you do have a lot of data on BMAC for other joints. And so it makes sense to use that for the spine as well in the right cases. And then I think that approach of hitting every layer that's affected, whether it's facets, ligaments, other parts of the spine, it's smart because that prolotherapy perspective of hitting that whole unit is it's not necessarily shotgun. It's more targeted in a very reasoned understanding that in the musculoskeletal system, you really have layers and layers of depth of pathology, and one level to the next level affect each other. And it is very hard to say, hey, this is your one level of pain. It's smart to treat them both because they're likely both pathologic.
You're absolutely right. More often than not, it's multifactorial, the etiology.
So tell me, I know before we had started recording, you had started talking about a study that you were starting to do for some of your spine patients. Tell our audience a little bit more about that, and what you're trying to achieve, what you're trying to learn from that as well.
Yeah. So after seeing good results in what we were doing, I thought I need to publish this so everybody can become aware of what's going on with BMAC and spine and the disc. So we started, it's the largest prospective controlled trial that I know of. It's going to have 35 patients in two groups. One group is control group. The other one is the treatment group. The treatment group, there will be 35 patients in each group. And these are patients that are having severe back pain with significant changes on the MRI. And the patients that we all see who've been having pain for many years, like I was saying earlier, who have seen multiple doctors, have gotten multiple modalities, and they're still in pain, we are taking the toughest of the tough patients and injecting bone marrow stem cells into the disc facets, SI joints, and in some patients who are having leg pain, we're also injecting the epidural space. So that arm has 35 patients, and the other 35 patients are the same patients who, when offered the stem cells for either financial reasons or medical reasons, did not want stem cells. These will be the control group. We started this in July, and the preliminary results just started coming back, and it looks very promising. What's interesting about this study is this is the first time we are reporting BMAC in the facets, SI joints, and the epidural space. Disc BMAC has been done before, but not in these other areas. And and we're including all of them based on the clinical presentation. Most patients are getting discs and facets. Some get SI joints on top. Some also get epidural depending on their pain distribution. So very excited to finish the study. We're halfway done. We've recruited about 20 patients. We need another 15 patients. So yeah, looking forward to these results.
That's outstanding. I think it is so important for physicians that are involved in the field to be communicating what they're seeing, what works, what doesn't work, how to do this ethically, to publish their results as well. I think that is so commendable and laudable on your part to be doing that. There was a blog post published by Chris Centeno recently where he showed the data on platelet-rich plasma. And just the evidence that's accumulated over the last 15 years in terms of its efficacy. And I had essentially shared that on Twitter. And somebody immediately responded, well, I'd like to see some head-to-head trials. And literally, there are head-to-head trials on orthobiologics. And so I think it's fantastic that you are taking it to that next higher level as well with the spine, because so much of musculoskeletal medicine doesn't always have that kind of head-to-head trial evidence. And a lot of times things that are seen as dogma or tried and true, when you do put it up against really conservative options, doesn't always live up to the hype, unfortunately. And the strange thing is that regenerative medicine is being held at that higher standard. And I think that's a good thing, because I think for musculoskeletal medicine, we should have higher standards like the rest of medicine does. And so I think it's impressive to say, here's what I think works for the spine, but now let me sort of put my, let me take it to a higher level. Let me put my reputation and my skills to that next level, and actually compare my patients who are sort of being treated in the usual fashion versus in the orthobiologic fashion. I think that's fantastic. How are some of your interventional spine colleagues? What are you hearing and seeing when you talk to them? Because I know you're relatively active at a state and national level with your colleagues and the societies in interventional pain. You also have a pretty active social media presence as well. What is the feedback you're hearing from a lot of your colleagues as someone who is experienced in the traditional interventional pain and now in the newer orthobiologic space?
The biggest roadblock, Siddharth, is lack of insurance coverage and reimbursement. And I think that's a big deterrent for most of my colleagues and my friends. It is a lot of work because, as you know, there is so much to learn. It's almost like doing a perpetual fellowship. People can dabble in it, but if you want to do it the right way, it's a lot of blood and sweat. It so happens that you and me are fortunate because we enjoy it, so it doesn't feel like work or hard work. It's our passion. But I don't see that in a lot of my colleagues. I think a lot of it is because insurances are not covering it. There is some interest, but not a whole lot. And even among my friends and colleagues in Cincinnati area, very, very few are doing what we're doing. I don't know. As more and more younger physicians join our field, maybe there'll be more interest. But it is getting more popular, but not at the pace that we would like it to. And the other bigger challenge is I've been doing this for about more than 2.5 years. It's very difficult for patients to get this therapy, unfortunately, because not many can afford it. Volume is also another issue. Patient access is another issue. I think these are the major roadblocks why it's not becoming more rampant, especially with the results that we're seeing.
I really like how you referred to the learning process as like a perpetual fellowship. Because one of the joys of being a physician is that you're never done learning. And the human body is, there's so many layers of depth to it. And every time you think you know something, you find along the way that, okay, here's something new I need to add to what I'm doing. And I think that's one of the wonderful things about being a physician, that as we learn more, we can continue to not only grow professionally, but we can continue to add to our local communities and the people who trust us. I think that's wonderful. I think it's actually a good approach where you feel so deeply passionate about something, you feel almost like a zealot trying to talk about it. I talk frequently about how anytime I have my parents or in-laws in town, I automatically have 2 more patients that need to be added to the schedule, because the reality is I wouldn't want them to be treated in any other way. And I think that's a key part of this, that how do we spread the word about what is right and ethical? And I like the approach that you're taking, speaking to colleagues and especially specific conferences, because we have to help to define to even them what's the right way to do this. I know something that we see a lot on social media, on LinkedIn in particular, in forums that are specially specific to regenerative medicine, is look at all the bad approach to this stuff, and how do we educate our colleagues to do their best version of that. Tell me some of the feedback you're hearing from colleagues. Is it really strictly just a matter of, hey, how do I get this covered, or hey, how do I learn this? How much of it is a lack of professional interest or interest in sort of growing?
I think everybody is interested. They're very curious. They talk to their colleagues who are doing it, and I'm sure most of us who are doing it are getting similar results in patients. But it is a new field. Like for example, like I was telling earlier, I was mainly a spine guy, and now I'm doing a lot of interventional orthopedics. I learned a lot from Dr. Centeno and Dr. Buford, and it was a challenge. Learning ultrasound was a challenge. I was a fluoro guy. Now, when you want to inject the tendons and the ligaments, and you want to do the nerve blocks for anesthesia, when you do subchondral injections, you do need ultrasound guided nerve blocks so they don't feel the pain. As you know, they were extremely painful, unlike other injections. Learning ultrasound was a totally new ball game. So it's a lot of effort, and when they know that they're not going to get reimbursed for their service, it becomes more challenging for them. And I just wish more and more would be interested, and that's why I like to do all these ACIP courses and inspire other interventional pain physicians to get into it. So many patients can be helped by this amazing therapy.
I like how you use the word inspiration, because I think that's a large part of it. And I think leading comes by not just talking, but definitely via role modeling as well. And so I think it's courageous to kind of step up to your colleagues and say, look, this is the next way to do this, and this is the path to that. And the reality is that government regulation or big tech regulation when it comes to internet advertising, it's not very subtle. It tends to be a little bit too blunt and broad in terms of how it works. That's the general problem with regulation. And in medicine, we do have a long history of traditionally self-regulating, self-educating, keeping us on the right path. And a lot of that comes from dedicated, smart physicians such as yourself taking the time and effort to spread the word. And knowing that at early stages, there's curiosity, but not a lot of acceptance. And progressively, there's more interest. And progressively, it becomes almost just standard of care. And it has to start with a dedicated cadre of ethical physicians who are willing to put themselves in the limelight and say this is the right way to do it. So kudos for you to you for still sticking with it, even though some of the feedback is mixed. And when you put it in the broader perspective of things, whether that is how do we reduce the cost of care, how do we reduce the opioid epidemic that we have in this country, all of those things. How do we do a better job of treating human beings that have chronic pain, for God's sake? Orthobiologics are going to have a future in that, without a doubt. And it's more a matter of how do we introduce it to the general population in that ethical and appropriate manner. So well done to that. We're getting toward the end, and I really appreciate your time. Tell me some of the things that you are really most excited about orthobiologics and regenerative medicine. What are some of the things that you're most looking forward to?
In an ideal world, I wish SVF was available to us. I've never, I don't know how the results would be. Just the fact that it has way more stem cells compared to bone marrow. I'm extremely curious to see how that would play out in terms of results. Having said that, we're seeing really amazing results with bone marrow, even in the elderly. Would I miss SVF? I don't know, but I would, if I wish, if I had a wish list, I would like being approved. The amazing thing, what I've noticed, Siddharth, over the years of practicing this, the most powerful cell is the one which is least manipulated. When I first started, I used to add to my bone marrow some PRP. We used to try to clot it by putting thrombin or calcium chloride. I used to use PPP, filtered PPP, to concentrate the A2M in the PPP and the growth factors in the PPP. And what I've realized is all of that is unnecessary. Simple bone marrow concentrate works really well. And I truly believe, and that's the beauty of it. You have all these scientists working hard, trying to manipulate the stem cells to get the best results. Maybe there's a role for these stem cells in other exotic conditions like heart failure or neurological diseases. But when it comes to the musculoskeletal arena and taking care of inflammation, I'm really astounded by what the bone marrow stem cell does. And without any adjustments or manipulations or additions. So yeah, other than trying SVF, I really don't have anything to look forward in terms of innovations. Maybe something will come down the road and I'll look into it, but so far so good, Siddharth.
Yeah, well, the wonderful thing about bone marrow is it is homologous. It is made for the musculoskeletal system. It's as musculoskeletal as you can get when it comes to orthobiologics. And so there is something nice and pure about that. And, hopefully it remains compliant. And, if you talk to some of the folks that have been in the field for a while, they're hopeful that as regulatory bodies get a handle on this, and as physician organizations start to get a handle, specialty organizations start to get some involvement and handle on this, that progressively more and more orthobiologics will be allowed, which is exciting, and I think it gives our patients a better chance for better results long term, and keeps us learning and keeps us on our toes, which is always fun. Well, thank you very much, Sairam. For the audience out there, if you want to let them know where they can find you, what is your digital presence besides stemcures.com, and anything else you want to mention to the audience?
No, I mean, that's the best way to get in touch with us. Our website, there's all the information, how to contact us.
Outstanding. Thank you very much, and have a good day. Bye-bye.
It was great. Thank you.
Thank you very much for listening to the show. I sincerely appreciate your time. If you found this content valuable, please leave a review on iTunes. In addition, if you want to automatically hear more content as it becomes available, please subscribe to the show on whichever platform you're currently listening on. Also, check out the website, regenerativemedicinreport.com, for show notes. Please let me know your thoughts and what else you want to hear about. Have a great day and live well.